Can you hear me well?
Yeah, I do. Okay, please share your work. Yes.
The presentation is shared. It's okay?
Yeah. Please start.
Good morning. Here in Argentina, it's very early in the morning. I'm going to talk about the food surveillance system and the monitoring plan for food safety management that we have here in Argentina. My name, as you said, is Lourdes D Esposito. I'm a food engineer. I am the director of the Office of Prevention, Surveillance, and Jurisdictional Coordination. Before I begin, I want to thank the conference organizers who made possible my participation today. And I bring you the greetings from the Authority of the National Administration of Drugs, Food and Medical Devices, and of course, the National Food Institute, which I belong. In this presentation, I will tell you about how the food surveillance system works in my country. And to do that, first, I will talk about the Argentinian food regulations, about how the national system of food control is made up, and about its organization, competence, operation, and members. And then I will get into the world of the food surveillance and how the state works to protect the health of the population. So what about our current regulations in Argentina? Our regulatory framework is established by law. The Argentine Food Code is a set of regulations for production, processing, and circulation of foods for human consumption throughout the country. The national system of food was created by a decree. Since Argentina is a federal country, the national system for food control established the responsibilities and defined the competence of national, provincial, and municipal agencies in the control of food safety in order to ensure the compliance with the Argentine Food Code. This system is integrated by the National Committee of Food, which is a technical body in charge of advising, supporting, and monitoring the system, and it ensures that its members enforce the food code. The National Service of Agri-Food, Health and Quality is a decentralized body under the Ministry of Agriculture, Livestock and Fisheries of the nation. Is in charge of executing the policy that the policy that the government dictates in terms of quality and safety products of animal origin throughout its supply chain and plant origin up to the primary stage of transformation. The National Administration of Drugs, Food and Medical Devices, which I belong, is a decentralized body under the Ministry of Health of the nation. Through the National Institute of Food, is in charge of executing the policy that the government dictates in terms of quality and safety of products packaged for sale to the final consumer. Also, it coordinates action with the health authority to strengthen the national system. And finally, the provincial and municipal health authorities are in charge of registering products and food establishments and also to monitoring the local store. And what does surveillance mean? Surveillance is information for action. It's the set of multidisciplinary and multi-sectoral activities carried out by health authority regarding the sanitary conditions of food and foodborne diseases. These activities allow them to collect, capture, obtain, record and assess information to guide actions and to identify hazards and manage their risk in order to prevent and control food incidents. Now, when we talk about preventing and controlling food incidents, our system has two types of surveillance, through which we obtain this information for action to come to action: the health monitoring system and the epidemiological surveillance, each with its own approach and activities aimed at the prevention and the control of foodborne diseases. In this talk, I refer specifically to health monitoring, which includes the prevention actions through passive surveillance, which involve receiving complaints from the community about allergies and from international network agency, and through a proactive surveillance, which actively searches for information and includes monitoring programs implemented to detect the commercialization of food that do not comply with the Argentine Food Code. Conversely, epidemiological surveillance responds to a case of foodborne disease, either epidemiologically confirmed or through a complaint from the community. So, what a food incident is? First, we must define what a food incident is to then focus on the steps needed to manage it. A food incident is an event that has potentially harmful consequences to the population as a result of the consumption of certain foods. It happened in at least one of the following situations: the identification of a biologic product, the identification of a foodborne disease or an adverse reaction relating to a consumption of a product, or the failure to implement the good manufacturing practice in the establishment, thus compromising the product safety and damaging the consumer's health. And how do we identify it? It is how the information enters to the system. It's how we find about an incident, and it could be by the food company through its internal controls, or by the health authority through surveillance, monitoring, and control action initiated at the national, provincial, or even though municipal levels. It may be identified because of different complaints from sectors like consumers, governmental, non-governmental organizations, health agency, information of an international incident involving a product commercialized by the country, or the media. Which are the entry points of these incidents? It could be by phone calls, by emails, through our website, or also personal communication at the health authority offices. And how do we investigate the incident? So, whenever health authority becomes aware of the existence of a possibility health risk, it initiates an investigation. On one hand, actions are taken to verify this incident. That is the reason why gave the rise to the complaint. And if it's confirmed, we have to verify the commercialization status. Since this verification, it's necessary to take certain management measures, and we will see them later. The actions that the health authority can carry out to verify the incidents are the verification of license and permits, the conduct of audits and inspections, product sample taking, lab analysis, and the evaluation of labels of the products. In other words, everything that makes possible to determine if there is a non-compliance and what the non-compliance entails, what food may be involved, the origin of the problem, and if the people are at risk of getting sick. Once the non-compliance has been verified, and before the risk has been assessed to determine the management measure to be adopted, it is necessary for the health authority to verify the commercialization. This part of what a legal area requires for allegation of the infringement. Here it is important to bear that the digital proof is considered sufficient for ordering the prohibition of the use and commercialization of a product. However, for managing these incidents, we use a tool, which is the Federal Information System for the Management of Food Control. In this field of federal work, and aiming to promote the strengthening of the control and surveillance capacity in the food area and to improve the response to food incidents, we implemented this digital platform, which enables the access to public information about the food we consume and allows food companies to be interconnected to strengthen control, facilitating their linkage and improving care of the population. On this platform, there are 3 federal surveillance modules: the federal inquirer that verifies and permits approved by the province. The releases, its goal is to streamline and improve the exchange of information between health authorities, especially in case of an emergency. And the food surveillance information system, the SIVA network, which I'll explain in detail. The SIVA network, it's a federal platform that integrates an online network that allows surveillance agents to notify, investigate, and exchange information in the event of food incidents of federal prevalence involving national or importing food, differentiating them by food risk or by food disease. And it allows to have horizontal operating of the system in which health authorities have the same updated information at all times and immediately, to interconnect simultaneously the jurisdictional food control authorities and to facilitate the coordination and planning of integrated management actions and the updating of a monitoring and information federal platform. The goal of the federal strategy of SIVA network is to consolidate and strengthen the federal system of food surveillance and the network organization. And who are its members? Well, it's made up of the provincial, the national level of the system of food control, and the municipal, like towns and city, through the provincial intermediation. There are 3 types of notification in this platform, according to their characteristics. The federal notification of suspected food incident, in the case that claimed deficiency has not been verified by any health authority through a control action, for example, a complaint from the community. A federal notification of detected food incident, which arises within the framework of a health authority control action. For example, a lab analysis, audits, license verification, or other actions. And the federal notification of incidents due to an epidemiological event, which communicates information referring to a case or outbreak of food disease detected by an epidemiological area, and the food products potentially involved in this disease. This is just an example of what a notification looks like. In this case, it's a detected food incident, but they are all very similar. The next step is assessing the risk. As I've mentioned before, once the incident has been verified, and especially those that entail a risk to health, a risk assessment is carried out to determine the risk management measure that has to be adopted. For this, all the information collected during the investigation is taken into account, and some factors are allowed, its estimations are considered. The exposure probability, the extent of distribution, the product's shelf life, the frequency of consumption, the product label, warning, etc. Probability or harm or damage due to hazard presence, type of hazard, product nature, storage condition, and product consumption, and the seriousness of the consequences, which will be classified as high, moderate, or mild. And it will depend, among other aspects, on the symptoms, the needed for medical care, medication, hospitalization, the complications, a long-term damage, the risk of death, etc. And finally, defining management measures. Once the risk has been assessed and all the information available on the monitoring actions has been analyzed, the health authority, taking into account whether the food company has been identified, will decide the management measure to be adopted and whether the product recall is pertinent, and if so, what its classification will be. The management measures can be the following: a recall, an adjustment of the level, a termination of license, shutting down the facility, the prohibition of commercialization, cancellation of the internet domain, stoppage of the manufacturing process, interdiction, follow-up audits. So to choose the measure, we will consider the risk and whether the food company has been identified or not. When the health authority cannot identify the food company responsible for the product that does not display data on its label, or they are apocryphal, or those origin it's unknown, the measure will be ordered immediately, will be the prohibition of the commercialization. On the other hand, where there is no risk and the company can be identified, it is a violative, but the management measures will be adopted in order to adapt the product to current regulations, such as a notification to the food company concerning the adjustment of the label, the termination of this license, the stoppage of the manufacturing process, interdiction, cancellation of the product advertising online. Finally, when there is risk involved, the chosen measure to manage this situation, it's only the product recall. And what is the difference between a recall and a prohibition? The aim of the recall is to remove the product from sale. It has a beginning and it has an end. It is classified according to seriousness and a strategy is defined. Health authorities monitor their appliance. A prohibition is an administrative act. It prevents the sale of the distribution of the product that does not comply with the regulations. It endures over the time and it's published in our official bulletin. In our regulatory framework, the food company is responsible for conducting the recall, since it is the only one who places the food products on the markets. But the health authority is also responsible for enforcing these regulations. The recall are the actions carried out by the food company to remove a product at any stage of the commercialization chain, either on its own initiative, like a voluntary recall, or at the request of the health authority, when it's not possible to identify the food company or it's not in position to do so, health authority has to conduct the recall. And the aims are to retain the products involved to prevent them from reaching the consumer and to retrieve the largest amount of the hazard products from the market in the shortest possible time to minimize the exposure of the consumers. The recall classification, we classify the recall dependently on the health risk, in which there is reasonable probability that the use of consumption of the product can cause serious consequences for health or even the death. The scope will be extended to the consumer level and we call it class 1. If it causes temporary or reversible consequences for health, we call it class 2. When the implicated product is intended for a specific or a sensitive population, or the risk assessment indicates that it's necessary to assure an alert to the population, we call it class 2C. And those situations in which there is a low probability that the use or the consumption of the product will cause health consequence, but it's a violative, we call it class 3. And what about the notification and the strategy? Here we have to contemplate the different possible scenarios. A voluntary recall is an incident detected and carried out by the food company. An agreed upon recall is an incident detected by the health authority, but the recall is carried out by the food company. And the third type, it's detected, the incident and the recall, by the health authority. It's when the producer cannot be identified or when the food company is unable to, or it refuses to conduct the recall. Which is the information provided by the health authority? Well, the product description, the name of the food, the brand, the food registration number, the expiration date, the list of the ingredients, the quantity of product manufactured, the distribution details. Also, the food company description, the name and address, the data of the technical director, the incident description, the reason for the recall, the non-compliance regulations, when and how the incident was detected, and the proposed actions, classification in case of a voluntary recall, and the strategy of the recall. It is closely related to the food company's responsibility to implement traceability procedures that allow to locate and track products throughout all stages of production, transformation, and distribution, and well as its own raw materials and additives. Is this the ability to reconstruct the product historical process, to follow the trail, to know the history, or to locate your products in an agile, fast, efficient, and error-free way? There is the backward that allows to know the raw materials that are part of the product, the packaging and other materials used, as well as to identify its suppliers in order to know the control that were carried out, the quantity, the batches involved, how the suppliers are. Then we have the process. It allows monitoring the product process in the establishment and knowing their characteristics, the control during the process and its finished products, how the incident was detected, when it was detected, and if complaints were received. And finally, we have forward. It allows to know where the certain batch of food products has been sold or distributed, the quantity of product and distributed product, the batches of affected product, the distribution levels and channel, and if exported, to which countries it has been exported. The recall strategy is the planned course of action that allows taking actions for the specific recovery for a product considered to be in risk. It entails the recall scope, or rather the depth of the recall. It indicates the level at which the recall should be extended according to the product distribution achieved. Geographical distribution, that indicates the scope of the recall according to the geographical area distribution of the product. The food alert to warn consumers. The population should be warned in class 2 and class 2C. Verifying effectiveness. It is the procedure that food company must apply to measure the scope of the execution of the recall and its results in relation to the immobilization of the products involved, the destruction, the reprocessing, the release also. The National Health Authority will communicate all recalls to the Provincial Health Authority, and it will be assigned the recall unique identification number to each recall. A food alert will be usually only at class 1 and 2C recalls. And as I already said, all recalls are available at the ANMAT website. The health authority will supervise the recall process to ensure that it's conducted properly and will verify its degree of effectiveness. First, at verification, we check if the strategic plan of the company is fulfilled and not existing in the market is verified. The provision is issued on the jurisdiction, the final destination is given to the recollect product. All possible actions were taken to ensure the end of the recall. And finally, we have the end, that it's considered that no more products can be recovered or when all products has been recalled from the market. Now, for closing this presentation, as I've mentioned before, we have different monitoring programs in which now our data is grouped in the monitoring plan for food safety management. This plan monitors establishment, food products, and packages that are manufactured or commercialized throughout the country. Moreover, it applies to control campaigns that arise through agreements with the different health authorities. The control of food processing establishment can be carried out by means of different documents that include verifying the compliance with good manufacturing practices, the hazard analysis and critical control points, as well as follow-up audits, among others. The food programs that we carry about are contaminants, nutritional composition, sodium content, lipid profile, gluten-free, important food, infant formula, non-authorized products. And finally, we have the campaigns that they are programs for specific products like bottled water or ready-to-eat foods. So that's all for my presentation. Thank you very much.